Jessica, why don't you introduce our guests here? We're listening to Vantage Point, by the way.
That we are. All right, so for today we have a special show, and I let Robin pretty much orchestrate all of this, and this is her baby. So this is something that she felt very passionate about. So this is her Rare Disease Day.
Hey, Jessica, thank you so much for letting me do this today. It means a lot to me.
It means a lot that you actually wanted to do it.
Oh, thank you.
And we have, Laura there?
Laura's here too, yes.
Go say hello.
Hi.
And we also have someone on the phone. Are you there, caller? Hello?
Yes.
Good. Hey, we got you. Okay, tell us who you are, and then we'll all get together and start talking about rare diseases. Hello?
I'm not sure how many callers you have.
No, it's just you. It's just you.
Oh, okay.
We just got you. You're participating, so I just wanted to make sure you're on at the start here with Laura and Robin.
I am. My name is Angela O'Down, and I'm a Ehlers-Danlos syndrome patient and a healthcare provider and a healthcare policy professional.
Thanks for being here.
Thank you for doing this.
No problem.
Okay, why don't you start us out with rare diseases? What is a rare disease? How many people do you need to not have this disease to be rare?
Well, there's all different statistics on rare diseases, but normally they say that rare disease, or an orphan disease as they call it, is one which is usually genetic, and normally 80% of all genetic rare diseases have been genetically mapped. There's all different points of rarity, and it's also dependent on the doctors, the medical field, and the country. But I don't know, statistically, EDS3.
If I can interject here,
go ahead.
It's estimated that 10% of the population has some form of a rare disease.
Yeah, that's
and
accurate.
That's probably an underestimate. That's based on those of us who have actually been diagnosed. And the World Health Organization shows that most of us, it takes an average of 20 years to receive a diagnosis, and we are misdiagnosed or undiagnosed. And when we are misdiagnosed, we are given treatments that actually have negative impacts on our health, which further complicates our health and our capacity to function.
Yeah, I mean, not only that, but if you get a wrong diagnosis, it's also going to postpone you getting an actual correct diagnosis. So normally the patients have to advocate for themselves. I know that's what I had to do for many years just to get my diagnosis of Ehlers-Danlos type 3. And then also I'm doing genetic testing coming up this week for type 4.
All right. Hey, I just want to interject really quickly that today is February 29th, 2016. For people listening on the web here, because the show is being recorded. And we're right now at 1:12, so you're listening to Vantage Point. So go ahead.
Yeah, we're doing this today because Rare Disease Day falls on the rarest day of the year, and this year also we've got a leap year, so February 29th, a little bit more rare. Usually it's on the 28th. But, it's very exciting that people were actually willing to participate at all, because I know that I had to create a lot of noise just to get anybody to respond. So I'm not sure who wants to interview first, but we could just kind of go different orders. Do you want to go ahead?
Yeah, my name is Laura. I'm here because my daughter has a rare disease. It's called neutropenia. And she got very, very sick at 8 months old. We were in the hospital for 2 weeks. She had a horrible bacterial infection where 40% of the kids die. It was very scary. At first they thought it was cancer. She had to get a bone marrow biopsy. And I was in Florida. I lived in Fort Lauderdale. And as soon as we got out of the hospital, I knew something was wrong because she had been sick more than just one in the hospital, and she was only 8 months old.
Right.
So, and then I went over her records, and because I'm her advocate.
Of course, yeah.
She can't talk.
Mm-hmm.
I mean, if I was sick, it would be different, but it was her.
Yeah.
And I had to...
You're her voice.
Exactly, and make it like it was the worst thing. And to me, normally when someone's sick, it's a cold. It's not your white blood cells. Do you know what
No, yeah, I know exactly what you mean. Like when you think you're sick, they think, oh, you just have the flu, it'll pass, or something like that.
And a lot of people are like, well, she doesn't look sick.
That's the worst one.
Don't you just want to slap people when they say
Yeah.
that? And even, it's just, she doesn't look sick, but her white blood cells,
Right.
it's almost like the bubble disease.
You can't see someone's blood cells.
Thank you. Or even some people have stage 3 cancer and they
Right.
look amazing.
Yeah, it really depends on the person.
Exactly. And So right now she has the neutropenia, and she can't, if she's being crowded places, if anyone's
Right.
sick, she gets sick. If she has a fever, she has to go to the hospital
Right away, yeah.
right away, and then she has to be admitted if her blood
Pretty much right away.
Yeah,
Yeah.
and she's there till, because this day and age, when they do a blood culture, it takes 48 hours
Yes.
for it to grow.
You got to culture it.
I mean, you'd think they've come up with something faster.
You'd hope so. Like you,
Right.
with diabetes tests or something, you just test her at home and see, like, is it too low? Is it-
Exactly.
do we need to go back to the hospital? or-
Exactly. And it's just funny because not a lot of doctors, not a lot of know about rare diseases.
Right.
And
Exactly.
you're-
They're
you're-
taught to not even think about
Right.
them.
You're honestly teaching the doctors.
Yes.
And
yes.
and they like are rude to you.
Always. Almost. Almost.
I
You've
thought
got your rare ones that aren't.
Oh yeah, it's very hard to find good doctors, and then they
Right.
get offended
Yeah.
when you try to tell them something. You're like, you didn't go to medical
Oh,
school.
I know. It's like I didn't go to medical school, but I can still read. I mean,
Exactly.
So when you bring your daughter into an emergency room because of her neutropenia and her susceptibility to infection, you have to advocate that she be seen right away so that she's not exposed to the other patients who may be infectious. And that might make you not the most popular parent bringing a child into the emergency room if the staff doesn't understand the situation.
Exactly. You're so right. I actually have to call ahead of time.
Yeah, I was gonna ask that.
and they have to have a room ready for her. She can't even wait in the waiting room.
Yeah.
So it's been really hard. Because now being winter, all
Right.
kids are sick all the time.
Yes.
And again, even if she doesn't look
Little
sick,
incubators.
yeah, if she has a fever, you have to take it to the
Right.
And it's just hard because they say it could go away, it could turn into something
Oh, they
else.
say it could go away. I was going to ask you, like,
Yeah.
I mean, like, what's the prognosis and, like, how long did it take till you noticed that there was something wrong with your daughter?
I just noticed she was getting sick a lot. I
Right.
noticed she was getting sick a lot, but to this day, I don't know if they know exactly what's wrong with her, which is why she gets monitored. We currently go to CHOP. We fly through Wings of Hope.
Yes, I've heard of that.
They're amazing organization, Wings of Hope.
That's cool that you've done that.
Yeah, and
actually.
because you want to seek out people, the doctors that see kids with these rare diseases.
And that want to figure it out and help.
Exactly, and there aren't many.
Not, especially not in Buffalo. I
No.
mean, there's a very sad, a lack of care here.
Exactly. And the thing is, none of the doctors, because I wanted a doctor here too, they don't want to work together.
Yeah, they don't want to work with another
it's
doctor
like-
that's in, like, like there's a doctor in New York City that I was looking into, and I would have to probably utilize, like, Wings of Hope or something. But
Exactly.
there's no doctor here that really wants to work with another doctor that's even just in
No.
New York City, which is ridiculous.
It
It's
is
like, I don't live
ridiculous.
there.
Yeah,
you know?
they had something they wanted to do a CHOP, and then they were talking to the doctors here, and she was arguing.
Oh, and trying not to let it happen or
and no,
something?
and she wanted to do a different thing, and then at the end of the day, you have to do your own
Go with
research.
the expert, too. I mean,
Oh,
I
exactly.
don't know, personally.
As a healthcare policy professional and also a healthcare provider, I can tell you, I'm a licensed clinical social worker. Unfortunately, many physicians, because of the demands that they have on their time, and because of their lack of knowledge and their concern about liability, they don't know what to do. And particularly in terms of managing their practices and being able to try to stay viable, and particularly if they're working for a large corporate practice, they will first screen you at the level of what insurance you have, and then they will screen by looking at your daughter's chart.
It's very
And
hard to get into the
Right.
clinics.
It's very hard to
thank
find
you.
even
Yes.
a pediatrician or a
Yep.
primary care physician who will take care of a patient with a rare disorder.
You're right.
And that's why we have to. I mean, it's crazy because
Mm-hmm.
we're sick, and many of us are disabled,
You're
and
right.
we are also more vulnerable in terms of our health. And yet we have to travel all over the country to see these different
Yes.
You're right.
professionals. And there is no CPT code, which is the code that's used for billing,
Oh, that
for
would be nice.
professionals to talk to each other.
Right.
So if we get a professional who's willing to consult with another professional, it's only because they care. They're
It's because
not
they
getting
want to
paid
do
for
it.
that
Yeah.
time.
Normally, they're going to pick the safer route, which is going to be
And
just to
the
not do it.
idea that electronic records are the answer is
No.
wrong, because first of all, the software
Mistakes.
is not being built to have rare disorders in them. So every time we go to the doctor, they have
Oh, yeah,
to
there's no
type in
code.
the
Like,
name
there won't be a
of
code.
what we have as they check a box called Other.
Mm-hmm.
And those systems don't talk to each other. And
'Cause
since
the
we're
software
we're
isn't
flying all
compatible.
over the country,
Right.
you know, even Buffalo and New York City, those systems are not going to be connected. So
They
the
should have one
specialist that
universal
you see in New
software.
York City is not going to have access to the records that you have. And so as an advocate and as a patient and as a parent,
You keep
we
your
have
own.
to get our own records and bring records to the different specialists that do
I
know
have
how to
actually a
treat
good
us.
story with that
I
one.
went through so many records, and every doctor writes rude comments about me.
Oh, my goodness,
It's
really?
like, really? Yeah, it says
I've only
mother's
had a
crazy.
few. Oh, like mother's.
Yeah,
too,
because I mean, when it's your kid.
Well, that's the thing is when you get the actual records yourself, then you actually get to see what they say. They'll
it's
try
a-
and stop you from getting them, but you'll
no,
get them.
it's so rude what they write.
know.
It's like, really? I'm just a
It's like, did you
concerned
think I was
mother.
never going to see it?
Yeah.
Especially since you're saying that I'm overly
Well,
concerned.
and it can
Yeah.
go beyond. It can go beyond rude. The
It
case of
Oh, yeah, it can go
Justina
into a lawsuit.
Pelletier in Boston, where the courts, the hospital actually took the family to court, and the judge took their parental rights away and assigned her to a guardian,
Yeah.
and she no longer got the care for her rare physical disorder and was assigned to get psychiatric care that she didn't need.
Psychiatric care only?
And it was the same judge months later that overturned that decision and restored the parental rights. But when providers
That's
don't
weird.
understand what's going on, this is the kind of thing that happens. And I had a similar situation when I
Yeah.
was providing care for my mother. I took my mother out of the hospital against medical advice because the treatment they were giving her was actually killing her. Literally, I'm not being.
I believe
I'm
it.
not
I believe it.
exaggerating. And each nurse in that hospital came to me independently and advised me, you need to get your mother out of here.
Oh. yeah,
And
that's
so
a-
what I did was I hired home health aides because I was working full time and I couldn't be there. I hired home health aides who participated with me in this, and those home health aides systematically would help her as the nurses had to dutifully dispense the meds that were actually causing her harm, would help her dispose of the meds. And as she got stronger with their care, once she was strong enough to leave the hospital and not be at risk of losing her life because of leaving too early,
Right.
I took her home, and she improved. She regained her ability to walk. She
That's good.
regained her ability to be continent. She regained her ability to swallow to a great extent.
Mhm.
And all of this is because we were responding to what we knew to do for her, not what the algorithms and treatment protocols that the doctors were doing
Well, you
that
just
they
went
knew
with
to
your
do
gut.
for the majority of patients, because she didn't fit that mold of majority of patients.
There needs to be an advocate for people with
Right.
rare diseases because, I mean, these doctors look
In
at
every
you.
city, at least,
yeah, they
you
look
know.
at you like you're crazy. Even if you say a symptom, they're
Oh,
like,
I know. They're just like, or they'll, how do you know that? You
Yeah.
know, I've had that question. You know, how do you know that you're this? How do you know that you're that? It's like, well, I have all my medical records here.
Right.
The last primary that I actually went to, because I'm trying to find a new primary, they wanted to keep all of my medical records for a month and said that there was no reason as to why a patient should have their own medical records, and they
What?
wanted to keep them from me. This was in Rochester.
And
We're
that is,
strong.
it is your right, your
I knew
legal
that, yeah, I
right
know. I
to
was
have
like, no
access
way.
to all of your medical
I was
records.
like, I'm
they
so
are your
sorry.
records by law.
That's when
Yeah.
I would snap.
I was like, no, you're absolutely not keeping these. I do need these, and it took me great lengths just to get these copies. So you
And
can
the-
make a copy. That's it,
The
though.
thing with primary doctors, especially in pediatrics, there aren't many. There
No.
aren't many, and there's so many kids to
changed a
each
lot, too.
pediatric doctor.
Yeah.
And they, with rare diseases, they're like, huh? They're
Right.
used to seeing the cold. I've gotten fired by a pediatric doctor because I wanted her to help me, and she really wouldn't help me. She's like, I'm like, can you call CHOP, the hospital?
Right.
She's like, if I had to call all my patients' doctors, I would never have time. And I'm like, isn't it your job to gather, all the information? And
You
it's,
can't assess it until you have everything that you
Well,
can.
that's
Exactly.
unfortunately, the reality is that is yet another myth. When we've heard about the Affordable Care Act and health care reform,
Oh, that was a mess.
what that
Ugh.
has achieved is that more people have insurance. It does not mean that more people have
Have care.
access to the health care that they need. And patient-centered care is really more PR. And the fact that primary care doctors are going to coordinate, that might be true further down the line, depending on how things unfold. We don't know yet for sure that things are going to unfold as planned. But at some point in the law, are going to be accountable care organizations where instead of being paid as a fee for service for each appointment, the group of doctors will be paid for outcomes. And at that point,
Well, that would be
there
smarter.
will be an incentive financially
'Cause then
for
they'll
the
have-
doctors to confer and to coordinate care. But now that hasn't happened yet. So the truth is that all the specialists send records to the primary care physician who are in the local region.
Right.
And you will have to specifically request outside of the region that the records be sent to your primary care doctor. But primary care physicians are so overwhelmed that they, frankly, and it's not their fault, they don't have the time to review every record from every specialist that comes in for all of their patients.
Right, which is too bad
So
because
that's why it's
their job.
important to make use of the portals when you can, and to be educated about the condition so that you can go onto the portal and look at the latest lab results and to look at the charts and make sure that what's being reported is accurate.
Right.
I think that with healthcare, it's crazy that you can't cross state lines, that there's networks. Because, again, if you have a rare disease, what are you going to do? You're going to look up the best place to
Right.
go to, and
Yeah,
you're
which
going to
I've done
go
a million
there.
times, and I haven't even.
Exactly.
I've looked it up, but it's just a dream, never going to come
Right,
true.
because if your insurance, if you have a New York
yes.
insurance,
you can fight
can't
Medicaid for
even Medicaid.
they're
You
not
can't.
gonna
You
wanna do
can't
it.
go out of the state. They don't. I'm like,
I know.
it's government though. What do you mean?
I know,
I
it's
can't
state
go out of the
insurance.
Well,
state?
I should
Yeah.
be covered
actually, there
anywhere,
is a way to
basically.
do that.
There
but
is,
it's very
but it's-
cumbersome to
It's
do
very
it.
hard,
Exactly,
though.
that's what I'm trying to
Yeah.
say.
Those people who are on disability or retired who have rare disorders opt to have Medicare, and then they opt for
That's what I'm
a
hoping for
Medicare
Medicare.
supplemental plan that their specialist out of the area allows them to see. Because if you have Medicare, you can use your Medicare benefit in any state.
Yes, but
And
not
there are
Medicaid.
some
Medicaid
there are
should be
some
the same.
Medicare supplemental plans that will allow you to see any doctor who accepts that plan. And in fact, New York State is one of the very few states, it may be the only state, that does not allow the insurance company for the supplemental plan to eliminate you on the basis of a chart review. So although
they got
pre-existing
rid of
conditions is
pre-existing.
no longer legal, they can
chart
still
review?
decide not to cover you on the basis of reviewing your medical records, which is essentially
Well, that seems a little bit
pre-existing conditions
lying
still
and backwards.
impact.
I mean,
The doctors
if you-
hold all the power.
I didn't know that one.
Yeah.
But if you have Medicaid and there's no local physician who is qualified to take care of you, you can get the
But there
documentation
is.
of
That's the
2
thing.
or
You can,
3.
but you're going to have to
There always
through
is
a lot of
someone. It's just they're
proofs
not the
there.
best.
Right.
And you want
Well,
again. You want
if
the
you
best.
have, all you need to do is get the documentation of 2 or 3 physicians that say there are no providers in this region that
make
are
a statement,
qualified
right.
to truly effectively care for this patient.
It doesn't even.
And then you can get authorized by New York State Medicaid to see an out-of-network provider who would be a specialist, who would be better qualified to take care of that patient. But you have to jump through the bureaucratic hoops to get that documentation and submit that.
Can
to
I
get
just
the
say
waiver.
something? One thing. That is true, but these institutes don't want to take it because even if I was to go to CHOP right now and I have Medicaid and let's say they accepted me, even when I go there, because when I go there they do testing,
Right.
the Medicaid isn't going to approve the testing right away. So what would be the point of me going out there if I couldn't even get blood work done because
Oh,
it
I
takes
know.
for approval?
What would be the point? Yeah, I
There's
know.
no point. So I had a job. So I had insurance through my job, which it's Ulta Beauty. It's everywhere. So I could go
Right,
anywhere.
That's the difference.
But
It's a big difference.
exactly no longer work, and I'm paying for Cobra,
Yeah,
which is
Cobra is
$450 a month,
I had
just
that at
so
one
my
point.
daughter could go to CHOP.
Yeah.
And there's nothing else I could
I mean,
do.
like, I wish that I didn't just have Medicaid. I wish that I had another supplemental plan with it, or just
It's
another plan
expensive.
altogether. Because I
insane.
mean, yeah, I have Medicaid, and yeah, it's state insurance, but I really do not understand. I mean, any doctor should take Medicaid in my mind.
People look
they
at you
can bill
differently
Medicaid.
too. If you
Oh, I
have-
know they always look at you differently. If you're
like I've
Medicaid
had a
only, it's like,
doctor say this
"Ah!"
once to me. He goes, "What do you care? You don't pay for it."
I know.
I'm
It's like, excuse me, I did actually pay for it when I paid my taxes
Right.
and I was working up until I became disabled or
Exactly.
caring for my child or whatever. You did pay for it.
Exactly.
You put money into that pool, so therefore you should
I
take
agree.
the money out of the pool. So, I mean,
And
I apply
I
for
think-
disability. I don't feel guilty or anything.
No.
This
shouldn't.
is a good time to bring up that there are a lot of people who do fundraising through social media to pay for their care.
Right.
Because
which
even
I
though
did
they
a
have
little bit.
insurance, the deductibles and the
I'm
high
so in debt.
copays,
So
or
in
the
debt.
or
I
the,
know,
that
me
the,
too.
the
Medical
specialist that
bills
they
is a
need
big
to
thing.
see won't see them because they don't participate in the insurance. And you know, if you can't get the documentation for Medicaid, or once you get that documentation to see that other provider, they're not able to do what they need to do because you have Medicaid, and that won't cover the other things that they need to do their job. You know, then a lot of people use social networking and either GoFundMe or other
Right.
types of fundraising, and that's the only way that they're able to access the care.
Yeah, I mean, and that's really a hit or miss. I mean, some people will get tons and tons and tons of funding, and then other people just get a little bit, and it seems like some people
Especially
get it,
with
don't
rare
need it.
diseases, there isn't a lot of funding.
Yeah.
And cancer, I mean, cancer's horrible,
Right.
but at least there's so much money
Well,
to
like
cancer.
this is like one big argument. This is one thing that I actually wanted to state today
Yeah.
is that I know 2 different cancer survivors. One of which told me when I found out that she had cancer, I went to her crying, and I was just like, you know, I can't believe you have cancer and all this. And she's like, don't feel bad for me. I feel bad for you because at least there's a cure for me. I have hope. What are you clinging on to? There's no cure for you. And then another cancer survivor that gets absolutely really mad at me if I even compare cancer to Ehlers-Danlos syndrome at all. I'm like, well, you got cured. You're
There's
fine.
no comparing anything. Everyone is doing their own battle,
Right.
going through it, and
It's like, I know
it
she
annoys
figures
me
it
because
down.
even doctors are like, well, at least she doesn't have cancer. Well, at least there's a cure to cancer. I mean,
For
not a
most
cure, but
cancers,
there's
yes.
you could go through
At least
chemo.
there's something that you
yeah,
can do
exactly.
to try and treat it. There's a treatment.
All right, I got a question for you.
Go for it.
I have an elderly parent, and I've had 2 of them. In fact, one
really?
is
That's
one
so
has
strange.
yes,
Yeah, weird.
one has since passed. But I've had the same problem with doctors, with elderly parents that you're experiencing. And basically, they don't like when I question them, when I look on the internet, when I tell them what's going on. They tell me, they say, look. They say, when you get your degree, then you could tell me.
I hate that.
It's
Yeah.
so rude. They just say
No,
that.
they just
It
they,
depends on the doctor, to be honest. I mean, like,
Most
I
of
just
them
do
are.
my research on the doctor specifically before I even bother to see the doctor.
Well, we have a really good one now, but before, my dad was in the hospital with multiple myeloma. It's a blood disease.
That's too bad. Yeah.
Yeah, it was bad. He was in intensive care. He had the C. diff.
Right. Okay.
Okay, and I walked in the room and I'm like, with my nose I could smell. He's got
Yeah.
the C. diff.
Yeah.
Oh,
And
okay.
and this was intensive care, and they told me
Yeah.
when you get your degree.
Like,
right? I'm like, no,
What did
get
you
it.
say?
I'll tell them to
I-
go back and go get their degree.
Well,
then.
I got animated, of course, and they almost had a security escort me out. But what happened was afterwards is that 3 hours later I came back. His room had the sign quarantine. I had a face
Oh,
mask,
yeah.
face gloves,
Right.
you know. I never saw that nurse again, but boy, they were like, well, how did you know? I could smell it. I mean, you
It's
guys are
just-
professionals.
It's just from having experience. I mean,
exactly.
I don't know. I guess I normally don't have too much problem with doctors. I think that they just take me more seriously. I normally hear them tell me that I'm well educated, and then normally I just say, well, actually, I'm just well read because I haven't finished my degree yet.
And it's you, yeah. I
think
they
it's just a
tend
way
to
of carrying
pigeonhole? Do they tend to pigeonhole you because the elderly they kind of pigeonhole?
Depends.
Because you're the advocate. If someone
depends.
else is the advocate, that's what's hard. It's not like
Yeah.
you're out they're talking.
Right.
You're the advocate.
Right? They hate me.
They hate you and they hate me too
Yeah.
because I'm exactly.
It depends, though. Like, I think that it's really just a way that you carry yourself because, I mean, I learned as I went on from like 5 to 7 years. It took me to get my own diagnosis confirmed of Ehlers-Danlos type 3. It's just a way that you talk. Like, if you talk in a reassuring tone.
I don't have that tone.
It's
I don't
just
have
instead
it.
of sound like patience and like you're trying to have a back and forth conversation. A lot of doctors will do that.
I could learn something from you. Yeah.
Yeah,
Definitely.
yeah. I'm more.
I'm like
I'm
yeah,
more or less
problems.
like Laura. Like,
Yeah.
I'm taking prisoners here.
Right.
well, that's basically like kill them with kindness.
I
You
need
just-
to
you
try
gotta-
that. We need to try that.
Yeah, you just have to be less like I'm coming to get you or something. Like I don't know, they fear us if we know a lot of knowledge.
They do.
But if you come off like you want to have a good conversation, you want to help the doctor learn, and you want to learn from the doctor, then you can end up developing a good relationship.
Here's the thing, too. When you go to doctors, if you don't like them, it's your choice to go somewhere else.
Yes, you're hiring them.
Exactly,
is the
but
way that-
then-
I call it an interview.
But then when you go to another doctor, they're like, oh, this girl's been to like 3
Oh,
doctors.
I know. They're like,
we
you're
can
doctor
see it."
shopping. That's what I
Yeah,
had. That's what happened to me
she's
in my last
crazy.
appointment.
Yeah, exactly.
I was like, well, I am shopping for a new primer if you want to make yourself sound like a food group or something.
Right.
But I mean, I don't know. I hate that term.
Well, we did that, and I blew up all the doctors, and we have a wonderful primary.
That's good. You usually have to blow them all up.
And-
Yeah, find
and
the good
the-
one.
I mean, the mother was sick on Thanksgiving Day. I called up, the guy answered.
Yes,
That's
that's
the
a good
best.
doctor.
And
Mm-hmm.
he calls up all the time. He calls back. I call him up, and he's, within an hour or by the end, depending on how bad it is, the end
Yeah.
of the day, he calls right back up.
That's good.
That's amazing.
That's a good doctor then. Yeah, that's
And
what my
that's who you
primary used to
want.
be like.
That's
we just
who
got
you
very
want.
busy.
My son's doctor is like that.
Oh,
That's
really?
great.
Wow.
I guess
Can
I'll have
have
to
his
ask who your
number?
doctor is. Yeah.
Actually, we can in Lockport. I can't remember what his first name is. Dr. Beanie in Lockport.
Yeah?
He also
Maybe I'll
takes
take him in.
adults too. He's a whole family doctor,
Oh.
but he specializes in
I didn't know
pediatrician.
that.
And I
Yeah.
just recently found a good one, Amherst Pediatrics. Amazing.
Oh, yeah?
They're so great there.
That's good.
Amazing.
Yeah. Well, I guess, do you want, I'm just going to start this out by saying, I mean, the whole entire reason why I did this personally and tried to get help from Jessica and from anybody that would help, and I'm very thankful for Jessica helping, is basically for my son, who I'm not sure if anyone's listening. They could probably hear some,
Hey, we
a
can
little
hear
kid in
him.
the background
We can
there.
hear
So
him.
cute.
Here
Cute
and
as
there,
kid.
here and there, but he's very well behaved.
He is.
Yeah, we got to give him
Very.
a DJ hat,
Yeah.
though. I think when he makes general manager here in 20 years, you know what happened.
Yeah, he's walking around like he owns the place. But I'm doing this basically for him because my disease, Ehlers-Danlos syndrome, he's got a 50% chance of having it, and I can already tell that he has at least the hypermobility portion of it. Systemically, I don't know if he's going to have the same systemic effects, but he did have a lot of complications with digestion and his GI tract in general at birth. So he's basically got it. So I'm doing this for my son because I realized, growing up without anyone advocating for me, my family didn't notice that there was anything wrong. They thought that I was just having growing pains and they were just too bad or something. Like I
Right.
dislocated my knee at the age of 15
Ooh.
and
Oh my
that
God.
wasn't it was in my sleep. I dislocated my knee in my
Wow.
sleep, relocated it, then they took me to the doctor and they were just like, she'll grow out of it. And they were just like, okay. And I was like, no, everyone hold up here,
That's
please,
what they
'cause
say.
that's not going to
She'll grow-
happen.
Well, that's perfectly normal for everybody
Right.
to dislocate
Of
their
course, yeah.
knee in their
That's
sleep.
actually what he said. He's like, it's perfectly normal. It's a moderate to severe dislocation, but it's perfectly normal. It's
I
like, you
believe
have to
that.
be kidding me.
I believe
At the age of 9, I started having the carpal tunnel and tarsal tunnel syndrome because I've got nerve impingements. So at 9, I was complaining about being in pain, and my family just kind of treated it like it was growing pains because that's what the doctors were saying. And I just wish that they had listened to me more instead of the doctors, instead of just being like, she's just complaining about growing pains, because I just kept on saying, growing pains? I'm not growing, guys. It's like I'm under 5 foot.
Is it like arthritis? Like what kind
It's,
of pain is that?
I've got nerve pain, bone pain, and muscle pain. There's probably other pains that exist, but I
Right.
think that I'm kind of getting up there. I mean, I've got nerve impingement, so I mean, I've got stabbing, shooting.
Does it get
firing pain.
worse as you
yeah,
get older?
it'll. Oh yes, it gets worse with the decades. And after I give birth to my son, my primary told me that he thinks that I skipped a decade, and that it
Ooh.
just got worse from my immune system getting so revved up.
And they told
Yeah.
you couldn't have kids, right?
They
And-
told me at first, they had told me that I was sharing that.
Well,
with
that
you,
was
I couldn't
wrong.
have children. Yeah, I know that.
I know.
Not only that,
but
not only that, but
What was your first clue?
I thought it was a kidney stone. To
Yeah.
be honest,
Did you? Yeah,
I was
tell your story
95
of that.
pounds.
That's a good story. Yeah.
Yeah, I'm 95
You're
pounds,
small,
and I
very
kept on
small.
taking pregnancy test after pregnancy test. I took at least 5 urine ones, and then they did some in the hospital too, and they were all negative all the way up until the second trimester. I was
Wow.
1 week away from the second trimester, and then all of a sudden they're like, "You're pregnant," and I'm just like, "No, I didn't even believe it." It even
Oh
says it in
my
my
God,
chart. It
yeah.
says patient does not believe it, and then then they're just like, well, it's so faint that we think that you're losing the baby. And I couldn't
Oh,
believe they
geez.
said that to
Oh
me. It's
my
'cause I didn't really know how to
God.
feel, because I wasn't planning on having kids by
Right.
myself.
So-
Just
Were you excited though?
I was
mean, what-
excited, but I was very nervous at the same time because I wanted to adopt personally, just because of my genetics.
Right.
But I mean, there he was, and obviously I wasn't going to get rid of him. I couldn't even imagine.
Did they tell you to get rid of him? Like it wasn't safe for you?
Women and
What did
Children's
they say?
advised me to get rid of him.
They did,
They told
and-
me to
Wow.
have an abortion.
Wow,
That's-
so
so I
you-
went to Sisters instead.
Good for you.
Yeah, I was like, no, I'm not.
Sisters,
It's
sisters
funny.
in general,
Yeah.
just sisters
Yeah.
are better.
I won't
Oh,
even talk
yeah.
about children.
All I could
Children's
say,
is
those
awful.
doctors, you know,
She was just
They
like, have an
just-
abortion. I was
No,
like,
she didn't.
no, I'm serious.
those doctors.
You
It was
should go to
awful.
children's and show them your son.
Oh, I want to actually
You
go
did?
and just
That'd
be
be
like, yeah,
great.
I just want to be like, this is my son. Didn't
Yeah.
he come out beautiful? Even though you guys
I
said that he was
know.
going to be retarded and
Oh my
autistic,
God.
and they said the worst things to me because I found out the second trimester I chose to stay on my medications because I'd been on them for so many years, and at the second trimester, all congenital defects, we've already passed that point of
Right.
getting any more defects. So I'm like, if I taper off of these medications, some of them are anti-epileptic drugs. I have narcolepsy. Some of them are to make sure that I don't fall asleep while I'm driving, etc. I'm like, what? You're endangering my son. I mean, yeah, it's just, it was just ridiculous.
Did you have
So
a C-section or did you
I
do
had to have a
natural?
C-section.
You
Actually,
did?
one push, and my mom was just like, one more push and he'll be born. And I heard that for like 3 or 4.5 hours. Yeah, I pushed for 4.5 hours, and I had an emergency cesarean. They had to put me under and everything.
Oh, wow.
That's Kaiden saying hello. So this is Kaiden.
Say
He's
hi.
saying hello by grabbing the microphone. But, I don't know. How did your birth go?
Well, mine was good. I had a planned C-section. It was
that's
great.
good. Yeah.
So thank God for that.
Yeah.
But what ended up happening is my daughter was sick probably 2 weeks after she was born, and she had to go back in the NICU actually, because if your kid's
Right.
under a month old, they put them in the NICU, and she was there for 6 days sick.
Mm-hmm.
And then that was scary, especially because in the NICU they don't want you there.
Yeah. So Kaiden's now live. He's wearing the headphones. But, I couldn't imagine having my kid. And I remember my son was there for the 2 weeks or whatever, and I went in there and I just was like, I'm not leaving this hospital until I walk out with my son.
They don't want you there though. In
They
the
would
NICU.
not.
Yeah.
I demanded that. I was like, I will sit here the entire night,
Right.
and I'm doing every single feeding because they were saying that he wasn't feeding enough, and that's why they wouldn't let him come home.
That's
and
what
I was
you
like,
d- yeah.
I literally was just like, I'm not leaving here without my son. I'm sorry, but I will stand right here if I have to stand. They're like, we can get you a room or whatever, and then they're like, you can go. We're gonna just let him go. I'm like, that's what I thought.
Yeah, when your kid's in the hospital, you need to be there 24/7, no matter what they say. I went home when I was in Florida. That's where we were in the hospital. And when I came back, my daughter was all strangled
Yeah.
and her thing's screaming, and the door was shut. And
Oh my
I was
God.
like, what is going? I screamed at everyone. I had the manager there. Because at the end of the day, they're not there to watch your kids.
No,
they're not there to babysit.
They're just there to do their everyday job. You know,
Exactly.
It's just like,
They're like, you're like a number to them.
exactly. You're
Yeah.
a number. That's just like, that's what it's like with doctors sometimes, unless they really care. Like, it's like, did you get your degree for money or did you get your degree to try and help?
And they all say, they're like, oh, I went to medical school. Well, no one knows my child
Right.
more than me. So
Yeah.
I don't care what school you went to.
You just share for a minute. I'm just gonna get him. I'm gonna get him.
A little break here. A juice break. Hey, he was good for a whole hour, you know?
Right.
I feel like I had a completely different birth and everything. Like I was going in and I was trying to go in natural, but since my accident, since my body has been degenerating at such a rapid rate, like nobody knew that I wasn't going to be able to have the baby
Me too.
naturally.
My first
Yeah,
daughter,
they're
because I have two
surprised
kids,
for me, too.
I went in and tried to do it naturally, and it was, I couldn't. And you almost feel bad because, you want to experience
you
the
feel like
natural
you didn't
birth.
Do it, yeah.
Yeah, you're
After 4.5
exactly.
hours, though, I was just like, I cave. You guys can do it.
Right.
Because I was really like, no, not after I've already come this far.
It freaked me out. I felt like
had to go under
getting
and
a
everything.
C-section was like,
Oh, it
the
was
Hannibal
awful.
Lecter
It
when they're
was
like
awful.
cutting in their brain because
Oh.
because they're cutting
I
you
can
and you
imagine
could
that
feel
freaking,
it. Do you know what I mean?
I
But-
went under though. So
Oh, you
thankfully,
did?
yeah.
I wanted
had
to go under.
It actually wasn't. I don't know if it was better or not because I ended up waking up during part of the procedure and I was
What?
paralyzed because I have narcolepsy.
Oh my
What they used to
God.
put you under will make people with narcolepsy prone to have what's called sleep paralysis. It's where
That movie, isn't there a movie about
yes,
that?
there is. There's
oh
a
my
movie on it.
gosh.
It was awful though because I could feel them cutting into me and I was screaming at the top of my lungs, at least trying to. And then when I came to fully, I apologized to the nurses. I was like, I'm so sorry for screaming like that, but I was just in so much pain because I kept on saying, this amount of pain should not be legal, is what I kept saying.
Wow.
And then they were like, we couldn't hear you. And that's when I was like, sleep paralysis, great. Because, I mean, it's happened to me before, but.
That's crazy.
Yeah.
Wow.
I mean, at least, he came out safe and healthy. I came out with a blood pressure that was like unmanageable, but, everything was fine. I'm not sure which way it would have been better, though, to be honest. It was crazy.
No, yeah, definitely.